What's up, everyone? This is Courtney with a K, and today I would like to share a little knowledge with you, which is going to explain my video. So last month I was doing my weekly breast exam, and during my breast exam I noticed that I had a lump. Now this lump is not normally there, so I went to my doctor, my primary care doctor, and told her that I had a lump in my breast. Now ladies, if you don't know what a breast exam is, every year you go see your primary care doctor, they give you an annual. Now this is only done for the ladies. While doing your annual, you're going to get your pap smear done, and your doctor is going to check your breasts. Now how you do a breast exam is you take your shirt and your bra off, and your doctor will feel your breasts, and she will go in a circular motion, and she will do this under the nipple, over the whole breast, and she will do both sides. Now if she feels any lumps or any bumps that's in your breast that's not normally there, then the next step will be for you to go get a mammogram done, just to make sure that the lump is not cancerous. So that's what we're looking for, ladies. We're looking for any lumps that could be breast cancer. So I found my lump, told my doctor, she gave me an exam, and then she told me to go get a mammogram. Once I went to the diagnostic office and got my mammogram, they recommended that I get a breast ultrasound. So then I got a breast ultrasound. After the ultrasound, they recommended that I get a breast biopsy. So in this video you will see me getting ready for my breast biopsy, and I'm going to share with you my experience and how everything went after the biopsy. So watch this video and tune in to the end, and I will explain more. Today I'm going to introduce my boyfriend. His name is Jason. Say hello.
She ain't doing nothing. I don't know why she thinks she's doing something.
Stop, be nice. So today I am going to get a diagnostic done. I found a lump on my breast, and so today I have to go get a diagnostic breast test done, just to make sure that the lump is not cancer. So my boyfriend was nice enough to take me. Thank you, baby. Give me a kiss. And we're just going to keep you guys tuned on what's going on today. So I'll be checking in with you guys shortly. Alright? Bye. I just got my biopsy done, and I'm in a little bit of pain. So I have steri strips on the area where they took the biopsy, and I just took some Tylenol. I'm not allowed to take anything like any blood thinners as far as aspirin, ibuprofen, so I'm just supposed to stick with Tylenol. I'm going to go home and rest, and I will let you guys know what happens after that. Alright, so now that you saw the video, I'm going to explain what happened during the biopsy. So I was told to take off my shirt and my bra, and they gave me like a robe to put on, and I had to lay flat on my back on the bed. They had me turn to the side, one of my side positions, and the breast that I had the lump on was up toward the ceiling. So the doctor had to put some iodine on that breast, and what that does is it kills any infection, and once the skin is opened, no infection can go in. After she applied the iodine, she then stuck a couple needles into my breast to numb the area. So I didn't really feel the needles going in, and she said that the numbing medication, which is called lidocaine, was going to burn a little bit, but I didn't really feel that either. I didn't really feel a burning sensation. After she numbed the area, she had another needle which was a lot longer and a little bit thicker. And right before that, she had to make an incision. So she took her scalpela and she cut a little incision in the breast on top of where the lump was located. And then before she stuck the larger needle inside of my breast, the tech put the ultrasound monitor on my breast, and so that they were able to see where the lump was located. And then she applied the longer needle and stuck it down into my breast where the lump was. And she had to take about 2 to 3 tissue samples out of my breast. So I didn't feel that. All I felt was a lot of pressure, and it was a little uncomfortable because there was a lot of, I could feel the doctor pushing down on my breast, but that was pretty much it. I didn't feel anything sharp going into my breast, so they didn't give me anything to calm me down, and I guess I didn't need anything. So after she was able to take the samples, she then applies the needle one last time into my breast, and she had to put what's called a marker. Now this is like a little metal piece, probably about that big. They apply that inside of your breast so that when you get a mammogram done, you can see on the in the pictures where she took the tissue samples. So after that was done, they cleaned up the area and they applied dissolvable surgical tape. In other words, it's called Steri-Strips. And when you apply these Steri-Strips to your skin, they dissolve on their own. Now, the first day of my procedure, I wasn't able to take a full body shower. So I had to take a low bath and kind of keep this area dry. But the next day, I was able to take a full shower. So after the procedure, I was very dizzy. I did lose some blood, and the doctor told me that I could take Tylenol. So I took my Tylenol, and that helped with the soreness, because after about 20 minutes, the lidocaine started wearing off. So after the Tylenol, then I just wanted to rest for the rest of the day. So I just fell asleep for hours. And so that was the first day. The second day, I was sore. Not as sore as the first day, but I was pretty sore. So I did take some more Tylenol, preferably extra strength Tylenol. I was taking that probably every 6 hours, just about. Now I am waiting for the results, and the results can take anywhere from 3 to 5 business days. And so once the results come in, my doctor will call me and let me know if I have breast cancer or if it's just a breast cyst. Now, a lot of young women get breast cysts. They just appear in your breast. It's not harmful. Most of them don't hurt. And the only way you can take them out of your breast is to get them surgically removed. But as long as it's not hurting you or affecting you in any negative way, I was told that they are okay to stay in your breast. But if it's multiple, then maybe you should, get them taken out. But that's between you and your doctor. Ladies, we have to keep ourselves knowledgeable about our bodies. We have to make sure we get our yearly annuals and make sure that we don't have anything internally going on that's not normal. So don't be afraid. Make sure you see your primary care doctor and ask the questions that you have. The worst thing is to just sit home and say, I found something, but I'm scared to go. and then you're sitting there waiting, and then what you thought, you know, could have been very harmful might not be harmful at all, or it could be harmful, but because you're not going to see your doctor, now it's gotten worse, and it's a stage 1, 2, 3, and there's nothing you can do about it. Ladies, do your weekly breast exams. I would like to thank you guys for watching and giving me this opportunity to share my story with you. If you have any similar stories, please comment down below, and don't forget to hit that like button. Also subscribe. Subscribe if you like to see more videos. Last but not least, this is Courtney with the K. Thanks for watching, everyone.
Cute or whatever, but I could introduce you to someone much better. You know that's me, much better. Bad bitch make money. Need someone to call you up when you're lonely. Or put it on your real good when you want it.